Regular medical tests and examinations help detect health problems before they develop into conditions that are difficult to treat and cure. Everyone has the right to have quick and easy access to quality health services, screening tests, analyses, accurate diagnosis and effective treatments so that they can live a healthy life. Age, family history and lifestyle choices, for example what you eat, how active you are, whether or not you smoke, etc., and other important factors influence the type and frequency of health services you need. Talk to your doctor about the importance of screening tests. Screening tests help you and your doctor to identify a certain disease, even if you don't have any symptoms or signs of illness. The aim is to diagnose possible conditions early by delaying or even completely eliminating the onset of disease. Early detection, followed by the right treatment and good management of the condition, leads to a much better prognosis and therefore a better quality of life. A positive screening test requires further testing. When are screening tests recommended? Screening tests are extremely valuable precisely because they can detect potential health problems while minimizing unclear, ambiguous or confusing results. They are regularly recommended depending on age, general health, family medical history and exposure to various risk factors. For example, mammography, which is part of breast cancer screening, is recommended for all women once a year from the age of 50 or even earlier if there is a family history of breast cancer. Screening tests that every person needs. Women. Cervical cancer screening. According to international treatment guidelines, cervical cancer screening consists of two tests, the Pap test, PAP, and genetic testing for human papillomavirus, HPV, infection. The Pap test is recommended, without the HPV test, annually from age 21 to 30 or 3 years after sexual debut. The Pap test can be performed conventionally, on a slide, or in a liquid medium. After the age of 30, both the Pap test and the HPV test are recommended every 3 to 5 years. Some specialists only recommend Pap testing every 3 years. Remember, Pap testing is only necessary after hysterectomy if the surgery was done as a result of cancer or precancerous lesions. Continue screening even if you have been vaccinated against HPV. Breast cancer screening. Breast cancer can be detected in the early stages, when the prognosis is much better and the treatment options are more effective, by screening mammogram, every 1 to 3 years, starting at age 40 to 50, clinical breast examination by the gynecologist, annually, starting at age 40 to 50, monthly breast self-examination, following the gynecologist's instructions, starting at age 20. Discuss with your gynecologist the importance of breast cancer screening and when you should start screening. Discover the benefits of digital mammography. Osteoporosis screening. Osteodensitometry is a radiological method and involves determining bone mineral density. It is recommended by the rheumatologist for the early detection of osteoporosis and the prevention of possible osteoporotic fractures, for all women, at the age of 65 or at the onset of menopause if they have associated risk factors. Osteodensitometry is done only once and, depending on the result, the doctor will decide on the need for further investigation. Men. Screening prostate cancer. The American Cancer Society recommends that all men talk to their urologist about prostate cancer, the importance of screening, and the benefits and risks of screening. The decision to get screened should be an informed one. American experts recommend screening starting at age 50 or even earlier, age 40, if there is a family history of prostate cancer. The investigation consists of a blood test to determine PSA, prostate-specific antigen, with or without examination of the prostate by rectal cough. The frequency of testing depends on the PSA level. Women and men. Colorectal cancer screening. Colorectal cancer is one of the most common and serious cancers. Fortunately, it can be detected at an early stage by having a colonoscopy, a method of assessing the rectum and large bowel. Colonoscopy is recommended once every 10 years for people at medium risk, starting at age 50. If you are at increased risk based on family medical history or other risk factors, talk to your doctor to find out when to start screening. Skin cancer screening. Melanoma is one of the most aggressive types of skin cancer, but detected in the early stages it can be successfully treated and cured. Skin cancer screening is recommended for all men and women from the age of 18. It includes clinical skin examination by a dermatologist, dermoscopy, examination of the skin and moles using a dermoscope. It is considered the most effective method of detecting skin cancer. In addition, monthly self-examination of the skin and moles is recommended to identify any changes in shape and color early on. Don't forget the APT rule, which helps you detect melanoma with the naked eye. Cholesterol screening. High cholesterol values increase the risk of heart disease, the leading cause of death worldwide among both women and men. Therefore, lipid profiling, LDL cholesterol, HDL cholesterol, total cholesterol, triglycerides, is extremely important in the prevention and early detection of cardiovascular disease. The cardiologist, internist or general practitioner recommends a blood test to determine the lipid profile every 5 years, starting at the age of 20. Diabetes screening. It is recommended every 3 years, starting at the age of 45 or more, often at the doctor's recommendation depending on family medical history. Screening consists of the following tests performed individually or as a package: measurement of blood glucose on an unsupported basis, glycemia, determination of glucose tolerance or glycosylated hemoglobin, HbA1c. Hypertension screening consists of measuring blood pressure values of all people, regardless of age. According to international guidelines, hypertension screening is recommended every 1 to 2 years. Combined screening, heart disease and type 2 diabetes. It is recommended from the age of 20, every 2 to 3 years, if the investigation values are within normal limits and includes the following tests: lipid profile, blood glucose, blood pressure measurement, body mass index, BMI, measurement. Children. Visual screening. Children should be assessed regularly to detect any visual disorders early. In the first year of life, your child can't tell you they can't see. They rely on you as a parent to detect any visual impairment by carrying out early eye screening. International screening guidelines recommend eye screening before your child is discharged from the maternity ward, or between 6 and 12 months, at 3 years, at 5 years, before starting school. Hearing screening. According to the Centers for Disease Control and Prevention, CDC, in the United States, hearing quality should be checked in all children by performing audiometry before discharge from the maternity ward or within the first month of the child's life. Preliminary testing from the time of birth provides reliable information about the newborn's hearing level. If the test reveals the possibility of hearing loss, the child should undergo a complex audiological assessment as soon as possible. If you like this video, don't forget to subscribe to my YouTube channel for the next health tips.